Dr. Jaffe, one of our customers writes in and says they have a 13-year-old with a recent diagnosis of inflammatory type ulcerative colitis. He's lost 14 pounds in the last 6 months. In addition to everything else they're doing, his parents would like to hear what you think is the best choice for additional nutrition to help their son move into remission. How does Perk plant-powered protein guard fit in? And they're looking for, other suggestions, please.
Yes, and thank you for that question. When we talk about an adolescent that has, say, IBS, irritable bowel, maybe some hypermotility, maybe occasionally some constipation or diarrhea, well, then just please engage with us and, if possible, start with the 4 self-assessments, the 8 predictive biomarkers, but at a minimum, the LRA by ELISA Act tests and plan. But the specific example here, a teenager with ulcerative colitis, that's a diagnosis. That's inflammatory bowel disease raised up to another level of affliction. There are always many dimensions to those cases, and whether it's regional enteritis or ulcerative colitis, there are always many dimensions. So my suggestion is, through drrusselljaffe.com, connect with us and find a time when our nutritional health coach, Jaya Srimani, can consult on the case and then discuss with me what we suggest. Because we will suggest nutritional suggestions that include prebiotics, probiotics, and symbiotics, and you can start on that if you want. We will suggest that you measure the amount of vitamin C ascorbate needed based on the C cleanse. We will suggest that you use the digestive transit time as a guide. We will suggest that the child be well hydrated. We will suggest that they get enough magnesium and choline citrate based on their morning urine acid excretion or pH. But we will suggest other things that we think might be helpful, from dichromatic lights to therapeutic biofeedback, from wilderness experiences in nature to gardening in individual situations. And again, with the engagement and understanding of the teenager. They're old enough to understand, and we want them to understand, and we want them to celebrate their successes and report where they have either not succeeded or slipped. Sometimes people slip backwards before they go forward. And so when we get to cases like ulcerative colitis, I think we should have individual consultations, and we do offer that as part of our ELISA Act biotechnologies, as part of our LRA by ELISA Act testing. It's what we've been doing for over 30 years, and we probably have seen cases like this before that we can show successful outcomes by comparison.